So when chronic liver disease of some duration gets decompensated and presents with an advanced presentation with the palpable liver, one can always consider the possibility of an underlying hepatoma or hepatocellular carcinoma. So that's one way of explaining enlarged liver. By and large, in 90% or over 90% of the patient with liver cirrhosis, the liver will be shrunken. So this is very important to understand here. Why I'm saying so? With the liver enlarged, you should make all the precautions to advance the diagnosis of CLD as the cause of portal hypertension. In
Yes, sir.
CLD, the liver shrinks. Okay.
Yes, sir.
So what could be the reason? I have already told you that maybe there are few patients, and early on, there may be the liver may be enlarged. There could be a macronodular process that happens in some cases, but that is very rare. So majority of the time, it will be a shrunken liver. And when you're advancing the diagnosis of portal hypertension due to CLD, you should always keep that in mind. Okay.
Yes, sir.
And as we said that we are not very comfortable assigning that our patient had a variceal bleeding. It may be some kind of a bleeding which is other than variceal bleeding. And splenomegaly. Now, splenomegaly is important, and splenomegaly sometimes can be quite a bit large. So,
Yes,
what
sir.
happens to spleen in a patient of portal hypertension? Can you tell us what is the size of spleen in a patient of extrahepatic portal vein thrombosis? What is the size of spleen in CLD? And what is the size of spleen in post-hepatic form of portal hypertension?
Uh, Sir, the size will be
Yeah.
more than 13 centimeter. The normal size is up
It
to
is a very
maximum 12
important question
centimeter.
that I'm going to answer for you.
Yes,
It
sir.
is that the spleen size depends upon the site of block to the portal venous system. Closer it is to the spleen, the larger will be the size of the spleen. And farther away from the spleen it is, the lesser will be the size of spleen. So, what does it amount to? That when there is an obstruction to the splenic vein or to the extrahepatic portal vein, the spleen will be very large in size. Okay.
Yes,
But when it is in the liver, when it is hepatic origin, the spleen will be moderately increased. And when it is post, what you call post hepatic,
yes,
then
sir.
the spleen will be just palpable. So you understood, how where the portal venous system is getting obstructed, that will determine the size of spleen. The
Yes,
closer
sir.
it is to the spleen, the larger will be splenic size.
Yes, sir.
And what about ascites?
So, ascites is mostly due to two components. First, due to portal hypertension and splanchnic vasodilation. And there is also, if in case of liver disease, there is hypoalbuminemia. Because of the low level of albumin, the ascites can be present, sir. There can also be presence of anasarca too, if in case of low albumin levels.
So ascites is not simply, due to the portal hypertension, but so many other factors get affected with it or get attached to it. And what are those factors that you very, very rightly said? One is hypoalbuminemia, and
Yes, sir.
hypoalbuminemia is generally a manifestation of the chronic liver disease. When the patient has chronic liver disease, the patient is very likely to have hypoalbuminemia. Second is, that when the obstruction is in the liver, there is a huge amount of lymphatic formation that seeps from the liver surface. When it is in the extrahepatic spaces, extrahepatic portal vein, there is no lymph that seeps from the liver surface. And when there is a block to the post-hepatic venous system, what happens is there is a huge amount of ascites because of all these factors getting combined and the pressure in the portal system rising extremely high. So, if you have to look at the ascites, all these factors will get added up to. So first and foremost is portal hypertension. Second is hypoalbuminemia. Third is poorly functioning liver. So all these things and the site of obstruction and a lot of lymph seeping from the surface of the liver. All these things will happen when there is a cause of portal hypertension within the liver, just like cirrhotic liver. Okay.
Yeah. Okay, sir.
So our patient is having ascites, our patient is having jaundice, and our patient is having spleen. Our patient is having spleen. So we are not very positive about the possibility of liver increase. We are not very clear whether the liver is enlarged or not, to be sure. Now, with this background, we are now clear about a few things. And let's be moving one thing at a time and move forward from here on. One, alcoholic patient. Second, ascites. Three, jaundice of mixed pattern.
Yes, sir.
And four, probably a variceal bleed or gastropathic bleed. So these are the four things that we have, which are absolutely uncontestable. So how do we move from here?
Yes, sir. Further, we may need to investigate the patient to confirm the diagnosis, sir.
So first and foremost is that we have to know what our patient is suffering from.